Are there effective therapies to suppress the immune system?
So most of the data which we have generated in this field is more in the form of case series or clinical experience rather than randomized controlled trials. And based on our experience and sort of the published data, we usually pursue immunotherapy or immunosuppression in a first line and a second line basis. First line are treatments which act quickly but might not have as significant impact as sort of the more chronic treatments, but we need the first line treatments up front. And these are IV steroids or Solumedrol, in some cases IVIG, in other cases plasma exchange, where we are filtering the patient's blood and taking out the pathogenic antibodies. And then we cause more chronic immunosuppression with the second line agents. That's where these are agents such as rituximab or cyclophosphamide. So in our clinical practice, this is the sort of the protocol we follow. Start with the first line agent and then put these patients on second line agents. In nearly all or most paraneoplastic syndromes, especially those affecting the brain, the cerebellum, the brainstem, we need both first line and second line. There are exceptions where patients such as Lambert-Eaton myasthenic syndrome, which is also a paraneoplastic syndrome, which affects at the level of the neuromuscular junction, so the connection between the nerve and the muscle. Sometimes starting with first line therapy, taking care of the cancer, giving some symptomatic therapy also does the job. It's not as simple for the brainstem or the cerebellum.
And can those immune suppressant treatments go simultaneously with the treatment of cancer, like chemotherapy or radiation or whatever follow-up treatments necessary?
That's a great question, and that's where we work closely with our oncology colleagues. In some cases it does, in other cases we have to be careful. One particular scenario is when we are using cyclophosphamide with other chemotherapies which causes significant bone marrow suppression. We have to be very careful in that scenario. Sometimes our oncologists don't feel comfortable doing both at the same time, and we have to have a staggered approach in those cases.